I'm really, really excited to be here today. I don't get out of my office that much, and it's really exciting to be with folks who are actually day-to-day trying to solve some of the more important problems that we're facing. Rebecca already acknowledged Robert Wood Johnson Foundation. Not only are they supporting this summit, but they've also supported a lot of the research I'm going to be describing today. I first wanted to start by putting Virginia in the national context in terms of its uninsured rates, and talk about some of the national patterns that have been occurring the last several years. And then I wanted to shift the focus really into Virginia and examine the role that Medicaid and FAMUS have played in covering Virginia's children, look at who the remaining uninsured children are in the state, the extent to which they're eligible for Medicaid or FAMUS, where they live, and then turn a little bit toward the future, exploring what the Affordable Care Act might mean for Virginia. So this map shows you the uninsured rates for the non-elderly in all 50 states in the District of Columbia. When you look at it from a 50-state perspective, Virginia is really in the middle of the pack. It's got an uninsured rate that puts it squarely in the middle range for states. But when you look at the data in Virginia and compare it to the national average for all states, you see that Virginia has a lower uninsured rate for all non-elderly. And that's driven in part by the fact that incomes tend to be higher in Virginia and employer-based coverage tends to be higher than it is in other states. But what's interesting, when you look at adults and children separately, you see that Virginia does better for both groups in terms of uninsurance, but that the gap is much bigger for adults than for kids. That's likely a function of kind of very different profiles of adults and kids served and their incomes and access to employer-based coverage. So while Virginia has an uninsured rate that is lower than the nation as a whole, recent analysis that we've been doing with newer data from 2010 suggests that the uninsured rate for adults may be rising faster in Virginia than elsewhere in the country. We're going to be doing more work on this in the coming weeks to try to understand what's driving that, but it does represent a departure from the past. As I said, uninsured rates for adults are higher than for kids, and that's true whatever state you look at and for almost any subgroup you can think of. But the differential is even bigger when you focus on the low-income population. So you see that low-income parents are over 2.5 times as likely to be uninsured as their children if they're living below the federal poverty level, and they're over twice as likely to be uninsured if they're between 100 and 200% of the federal poverty level. And when you look underneath that, what you see are that Medicaid and FAMUS together have really provided coverage to many, many children. We often think about this picture nationally, and we'd see the same statistics for Virginia, is indicating what uninsured rates would be like for kids if there weren't the expansive Medicaid and CHIP coverage that we have today. The last couple years, as Joan mentioned, have been ones of serious economic downturn, a dramatic downward shift in the income distribution nationally, losses of employer-sponsored coverage. But I think what's really amazing about the last several years is not that uninsured rates have gone up for adults, that we expect during an economic recession. Prior recessions have been accompanied by big increases in uninsurance. But what's surprised a lot of people and really represents a departure from the previous recessions is that we're actually seeing declines in uninsurance among children during the same time period. and it's really a function of Medicaid and CHIP picking up the slack that's been left by the declines in employer-sponsored coverage. So as Joan said, any conversation about coverage, kids' coverage, has to begin with the progress. And if I showed you longer time trends, you'd see an even steadier decline in uninsurance among children over the last 10, 13 years, and reverse a much growing, a growing uninsured rate among adults and parents. And so that really is the starting point for where we are today. So how does Virginia's children compare to the nation as a whole? There are a number of, I think, interesting differences that present a very different profile of a target population for Virginia than other states are facing. First, the higher income distribution in Virginia means that you have proportionally more uninsured kids who are in higher income groups. So there'll be more that will need to be targeted by the parts of the Affordable Care Act that Joan mentioned that have to do with the exchange subsidies and some of the other subsidies for employers, because as you'll see in a few minutes, Medicaid and FAMUS can solve a big chunk of the uninsured problem for kids in this state, but they can't make as big a difference as they can in other states that have proportionally more kids living below 200% of the federal poverty level. The other interesting compositional difference is that Virginia has proportionally fewer Hispanic children and more Black children compared to other states. And it has fewer in strictly non-metro areas and more in areas that represent a mix of rural and urban areas. And so you guys are facing a different set of kids when trying to address coverage. In terms of the structure of your programs, when it comes to childless adults, this new group that was targeted by the Affordable Care Act, Virginia is like most other states in that there isn't really coverage for childless adults unless they're disabled through Medicaid. For parents, Virginia is lower than what the norm is, covering parents at 31% of the federal poverty level. Whereas the norm in terms of the typical state is up at 64%, and Virginia is at 200% in terms of covering children through FAMUS, and that 6 years ago was the norm nationally, but the last 5-6 years have seen a number of states move their CHIP programs up the income scale above 200% of the federal poverty level because of the growing uninsurance problem in that income band. And so now the median state has an income threshold in CHIP that's 241% of the federal poverty level, whereas Virginia is at 200%. The parents' threshold I'm going to come back to later because that the fact that Virginia is at 31% right now, but 200% for kids, represents a real opportunity under the Affordable Care Act to easily bring in a lot of parents who are uninsured now into Medicaid. So currently, and this is data from Rebecca, so this is not my own data, but Medicaid is covering through Title 19 about 600,000 children. I think this is data from earlier this year. And its CHIP program has about 170,000 children in total, but interestingly, almost half of those children are between 100 and 133% of the federal poverty level and covered through Medicaid, a Medicaid program. It's through Title 21, and it comes through that block grant in terms of the federal financing piece, but in terms of the program and how it operates, it's operating as Medicaid. So while I've spent a lot of my career focused on CHIP, and many of you are here today because of FAMUS, it drew attention to kids' coverage. It in terms of raising the stakes and generating a lot of political and policy support and enthusiasm for covering kids. I don't think we should ever lose sight of the fact that Medicaid is where most of the kids are getting their coverage. And that's because poor children have so much less access to employer coverage than even children between 100 and 200% of the federal poverty level, who are the target income group for your famous program. Well, one way that we've been tracking how well states are doing at covering kids under Medicaid and CHIP is to look at the participation in those programs among the kids who we think meet the eligibility criteria according to the state guidelines for coverage based on information that families provide in terms of income and household structure. And what you see here is, again, Virginia is right in the middle. The participation rate for Virginia for the 2009, and we're working on the 2010 data right now, but sadly I only can tell you about 2009 today, had a participation rate which was very high for a means-tested program of 84.7%, and the national average is really the same. But what's interesting is that in 2009 there were 9 states that had participation rates that were 90% or higher. And I think it surprised a lot of folks once we were able to look at this at the state level, how diverse those states were. It's not just the usual suspects of Massachusetts and Vermont, the states that have the high incomes and not a very big problem to solve, but you have West Virginia and Arkansas and some states that you didn't necessarily expect to see with such high participation rates. And the next slide shows also, I think, surprised a lot of folks that in a one-year period, 29 states had significant increases in their participation rates. That's just in a one-year period. And you can see in some states, the gains were quite large. The states with some of the larger gains had lower participation rates to start with, so they had more room to grow. But I'll draw attention to Virginia here as well, because that was almost a 4 percentage point increase in participation in that 1 year. And I know from the contact I've had with folks at the state level that the state's really been making a lot of policy changes and efforts to increase participation, and it does seem like it's paying off. So, as I said, Virginia seems to be achieving a participation rate that's very comparable to the nation as a whole. But we do know that participation rates vary, and there are some patterns that are very consistent no matter what data set we look at and what state. If you look at age, adolescents participate at lower rates in the nation as a whole and in Virginia. And that's been true for as long as I've been tracking this. And it's true really in the, whether you look at the state or the national level. I know Virginia has initiated a number of innovative outreach efforts toward adolescents, and so we'll be assessing whether that's paying off as we go forward. But just to emphasize that the adolescents are a group where participation still lags behind younger children. I want to draw your attention to the race and ethnicity participation rates too. Nationally, Hispanic kids participate at somewhat lower rates than other kids. But in Virginia, the difference is more pronounced. And the biggest differential, and it's a small population subgroup, but this data source is very large, so I think the data are robust, is what's going on for the Asian and Pacific Island kids who are eligible for coverage. They have very low participation rates in Virginia. I also want to draw attention that in the non-metro parts of the state, Virginia seems to be achieving a higher participation rate than folks are achieving in rural areas in other parts of the country at 90%. So that might give us something to track down what's going on there, why are things working so well there, that might help inform other parts of the state of Virginia, but also rural areas across the country. Another way that we think about how well programs are doing at reaching eligible children is by just looking at the uninsured rates, because participation rates reflect the extent of employer coverage, which can vary across subgroups and across geography. So right now, and again, Virginia stacks up right square with the nation as a whole, about 1 in 10 eligible children in this country and in Virginia is uninsured despite being eligible for Medicaid or CHIP. And again, you see the adolescents, 13% of that group, 25% of the Asian Pacific Islander kids, almost 20% of the Hispanic kids. And so I think that gives us, it really reinforces what we saw in the participation patterns in terms of some subgroups where participation is lagging and lagging more in Virginia than in other places. So what do we know about where participation is higher or lower? This map, I showed you a map that focused on the cross-state differentials, but this really demonstrates that there's a lot of variation in participation within a given state. I mean, there's the darker portions of this map are the places in the country where the participation rates are below 78%. And you can see there's a lot of concentration in some of the western states and some of the parts of Texas and Florida. But you can also see in Virginia, and the next slide will show this a little more, that there's variation within Virginia as well. When you look at areas of Virginia, you see variation in the extent to which kids who are eligible for these programs are participating. And while it's a fairly tight distribution, we do have a spread of almost 10 percentage points between the areas with the highest participation rates and the highest and the lowest. And I think Rebecca and Kate are going to be taking a harder look at this data, because this doesn't indicate that the program is working less effectively in the parts of the state that have the dark green. It could be that there's a different composition of the eligibles that are just harder to serve in that area. So, but it could be suggestive of some policy differences that would be useful to pursue. As Joan said, nationally, about 2/3 of all uninsured children are eligible for Medicaid or CHIP but not enrolled. And her message is right on that. So what that means is, with no policy changes whatsoever, we could really reduce the number of uninsured kids in this country dramatically by millions of kids if we were just a little bit more successful and built on the success that's already been achieved at enrolling and retaining these eligible kids. Virginia has a little bit of a different situation. Our best estimate is that there are about 130,000 eligible but uninsured kids in Virginia. And our estimates suggest that just about 53%, or 71,000, are eligible for Medicaid or FAMUS but not enrolled. So that's below the 65 or 66% that Joan showed you, which is the national picture. I think this is driven by the fact that two factors. Medicaid and FAMUS have an income threshold in Virginia that's 200%. As I showed you earlier, it's higher in the typical state across the country. So you have more kids above 200% of the federal poverty level who don't qualify for public programs. But the other factor is related to the higher income distribution and the fact that more of your uninsured kids proportionately have higher incomes, and so that they can't really be reached by Medicaid and CHIP So what do we know about the kids who remain uninsured in Virginia but are not enrolled? They're a mix in terms of their age and their income, although the bulk of them are in this very low income group below 133% of the federal poverty level. We also know that they're mixed in terms of their race ethnicity. A quarter are Hispanic, another quarter are Black, 42% are white, 6% are Asian. So it's a real mix in terms of the cultural, ethnic, race backgrounds of the kids you guys are trying to reach out and serve. Most of them have parents, at least one parent who speaks English very well, but there's 13% are not in that situation, and so language could be a barrier for some of these kids. When we look at the characteristics of the remaining eligible but uninsured children in the nation and compare them to Virginia, you see that Virginia has fewer in this higher income category, and its race and ethnic mix is quite different. Fewer Hispanic, proportionally more white and Black and Asian Pacific Islander, and fewer in non-metro areas and more in mixed areas. So where do all these, this 70,000 odd eligible but uninsured kids live? I wish they were all, living within one area. That would be an easier problem to tackle, but it really looks like they're spread. You've got 9% down in the, I'm not going to use the right word to describe that part of the state. I live in Northern Virginia, so my knowledge is kind of a little weak. But they're really probably in all the places where you guys are working. There are uninsured kids. I mean, I think it's diffuse. So in order to make progress to close the coverage gap, there's going to have to be effort made everywhere, I guess, is the way to think about it. So looking ahead, as Joan indicated, the Affordable Care Act has the potential to profoundly alter the coverage landscape here in Virginia. As she indicated, the bulk of the increases in coverage are expected to go through your door, Medicaid and CHIP, or through the new exchanges. That's really where the new coverage is expected to come from. And when we look at baseline, in terms of thinking about the problem that Virginia has now and who's going to benefit from the different pieces, really, and I'm sure that you've digested this news, but I think some people don't understand how rare it is for very low-income people to have employer-sponsored coverage. The blue shows you the increases in the prevalence of employer-sponsored coverage as you go up the income scale. Employer-sponsored coverage is still the norm in this country, but not for low-income folks, particularly in the income group targeted by the Medicaid expansion. At the flip side of that is that the uninsured, while there's uninsurance at every income group, within every income group, those are the top gray slices of the bars in Virginia for adults, it's a much bigger problem for folks who are poor or near poor than it is for folks who are living at 4 times the federal poverty level and above. The next slide shows you the same coverage distribution, but for kids. And what's just absolutely striking, if I had put the adults and the kids side by side in Virginia, is the uninsured rate for adults was, for adults below 133% of the federal poverty level was 41%, and it's just 11% for kids in that income band, and that is all because of the big red coverage that's being provided by Medicaid to those kids. And as we look forward in terms of what the likely composition of the Medicaid program is going to be in the future, my colleagues who've projected this for the state and for all states expect that Virginia is going to see that the Medicaid enrollment in Virginia is about a quarter of it is going to be from these new enrollment groups, be they the childless adults who don't have dependent children, or the higher income parents above 38% of the federal poverty level who are not eligible now. So the mix of who Medicaid's going to be serving is going to change in pretty dramatic ways across the country, but Virginia's a state that's going to see a pretty profound change. My colleagues also estimate that the Affordable Care Act will reduce uninsurance among Virginians in each and every income group. The underlying reasons for that decrease differs across income groups. But as you can see, that the very biggest declines are expected for the very lowest income population. But even with all the changes in the bill, we still expect that there's going to be a non-trivial residual uninsured. And so we have to think about the implications for safety net capacity. And in Virginia, my colleagues' estimates is that we'll have about 500,000 uninsured after the ACA is fully implemented. But I want to draw your attention to the part of the pie that's in the lower right-hand quadrant. A good chunk of those, and this isn't just in Virginia, but nationally, are expected to be eligible for Medicaid and CHIP, but not enrolled. So we're not assuming that there'll be 100% participation under the Affordable Care Act, but certainly that there'll be major enrollment gains, but that a big chunk of the uninsured are going to be in that very lowest income group. Now, as Joan alluded to, the exchange in a way sits on top of Medicaid for families in terms of eligibility. And one of the important proposed regulations that I want to draw your attention to, because I know you focus on kids and families, is that the eligibility for exchange subsidies is proposed to depend on the cost of employee-only coverage, not family coverage. And I think we all know that it often costs substantially more to pick up family and dependent coverage through an employer-based policy than to pick up own coverage. So what that means is that kids, because they're dependents, they're not usually workers, won't be eligible for exchange subsidies, even if the cost to the family of obtaining family coverage through the employer is very, very high. Now, the flip side is that the family will not be subject to penalties. But what this means is that we could have an uninsurance problem, especially in a state like Virginia for kids, that doesn't cover kids above 200% of the federal poverty level, that you're going to want to be watching what's happening to kids' coverage between 200 and 300% of the federal poverty level, because those kids may not be picked up through the exchange to the extent that folks had anticipated they would be. Joan mentioned that there are some other issues that are unique to kids. As she said, kids and parents may be eligible for different types of coverage. Now, this can be both a function of how Medicaid and exchange subsidies are structured, but it also relates to immigration status, and Joan talked, I think, in more depth than I'm going to talk about that. But that, the fact that there are so many kids and parents who may be eligible for different things really emphasizes the need to integrate Medicaid and CHIP and exchange eligibility and enrollment processes, and to deal with some of the immigration concerns if we want to keep kids covered. And then second, the large number of kids who don't live with both their parents raises a number of other complexities, and in particular, may really mean that we need to revisit how child support orders are determined and how that interfaces with kind of the new ACA landscape. So as I mentioned earlier, nationwide and in Virginia, it's much more likely for poor, near poor parents to be uninsured than their kids. The Affordable Care Act makes all parents who meet the immigration requirements eligible for coverage through Medicaid so long as their incomes are below 138% of the federal poverty level. And there's really low-hanging fruit there in terms of bringing these eligible parents on. This is just hot off the press, but we're finding in our preliminary analysis that over half of all Virginia's uninsured parents have at least one dependent child who's living with them who's enrolled in Medicaid or CHIP, and that fully 70% of the uninsured parents with incomes below 138% of the federal poverty level already have a child who's in Medicaid or CHIP. So they're in the system. The family's already stepped up. They know about Medicaid. They're covering their kids through that program. And so really on day one or even right now, if there was the budget and the interest in doing so, it looks like as many as 70,000 uninsured parents could be enrolled by just pulling them in through their kids and not needing to undertake any new special outreach efforts targeted at parents since their kids are already enrolled. So I just want to close with a picture. And this map shows what the uninsured rate looks like across the state for adults 19 to 64 by area. Just to, and I know you guys are dealing with very different situations on the ground, but I think this makes the point that the size of the uninsurance problem really does vary a lot across the state, that some areas have uninsured rates that are well above 20%. So more than 1 in 5 adults are uninsured. Many of those adults are going to be eligible for Medicaid. And so that if I took this map, and we're working on a project that we hope will be able to tell us this, what will the Medicaid enrollment increases look like across the state? I think it's going to be very uneven. And I think that's going to have implications for primary care service delivery networks and capacity that we're going to need to be mindful of, because I think in some areas the increase in the demand for Medicaid services will be very, very large. So I'll just close by saying I'm really looking forward to hearing your questions and acknowledging all my co-authors and the different work that I shared today, and be glad to send you any backup if needed. Thank you.